Blood sugar secret, top 5 vitamins diabetics must know. Tired of the diabetes roller coaster? Constant blood sugar checks. The endless worry? What if I told you there were simple, scientifically backed nutrients that could be the missing key to unlocking better health? It's not just about medication, it's about giving your body the tools it needs to fight back. This isn't just information, this is a roadmap to real, lasting change. Get ready, because in this video we're not just going to talk about vitamins, we're going to reveal the 5 essential nutrients that every diabetic needs to reclaim their life. Welcome back to Healthy Inside. Today, we're diving deep into something that can be a game changer for so many of you, essential nutrients for managing diabetes. We all know diabetes is a complex condition that affects millions worldwide. It's not just about elevated blood sugar. It's a metabolic disorder that can impact everything from your energy levels to the health of your vital organs. While diet and exercise are crucial, many people with diabetes are missing a critical piece of the puzzle: specific micronutrients. These are the vitamins and minerals our bodies need in small amounts but are absolutely vital for countless processes. It's kind of like your car needs oil, coolant, and fuel. A healthy body needs these nutrients to run smoothly. When you have diabetes, your body's metabolism is already challenged, and deficiencies in these nutrients can make things much worse. We're about to explore 5 incredible nutrients that could make a profound difference in how you manage your diabetes and improve your overall health. Section 1, the Powerhouse mineral, Magnesium. Let's start with a mineral that's nothing short of a powerhouse: magnesium. Often overlooked, magnesium is involved in over 300 crucial enzymatic reactions within the body. For diabetics, this mineral is absolutely essential. You see, magnesium plays a pivotal role in glucose metabolism and insulin function, which are, as you know, exactly the processes that are disrupted in diabetes. It helps insulin work more effectively, allowing it to escort glucose out of the bloodstream and into your cells for energy. If you are struggling with insulin resistance or high blood sugars, a magnesium deficiency will only exacerbate the problem. Here's the really concerning part: studies consistently show that people with diabetes are highly susceptible to magnesium deficiencies. It's a vicious cycle. Poor blood sugar control can deplete magnesium levels, and low magnesium can worsen insulin resistance and inflammation, which are contributing factors in the development of diabetes and its complications. When you don't have enough magnesium, your body faces these major challenges. Worsened insulin resistance: your cells become less receptive to insulin signal, leading to higher blood sugar levels. Increased inflammation: inflammation is a key driver of complications like nerve damage, neuropathy, heart disease, and kidney problems, all of which diabetics are at a higher risk of developing. Elevated blood pressure: magnesium is crucial in regulating blood vessel function. Low levels can contribute to high blood pressure, a common concern for diabetics, but when your magnesium levels are optimized, something truly amazing happens. Imagine giving your body the vital tools it needs to fight back against diabetes and its complications. Improved insulin sensitivity: research published in reputable journals like Diabetes Care shows that magnesium supplementation can significantly improve your body's ability to use insulin, helping to regulate blood sugar effectively. Reduced inflammation: magnesium, according to research in the American Journal of Clinical Nutrition, can help dial down the inflammatory responses in the body, which can lead to reduced risks of cardiovascular issues and nerve damage. Lower blood pressure: by supporting healthy blood vessel function, magnesium can aid in maintaining healthy blood pressure. I remember when I first started specializing in diabetes care. I had a patient, a wonderful woman named Sarah, who was struggling with neuropathy. She was constantly in pain, had difficulty sleeping, and was just feeling generally run down. We were doing everything right with her diet, exercise, and medications, but she wasn't feeling any better. I had a hunch that her magnesium levels might be an issue, and after testing her, I was correct: she had a severe deficiency. We started her on magnesium supplements, and within weeks, the change was remarkable. Her neuropathy symptoms lessened, her energy levels improved, and she said she finally felt like she was getting her life back. Sarah's case really solidified how much of a role this mineral plays, often silently and overlooked, in diabetic health. How to get enough magnesium? Now, you're probably wondering, how do I get enough magnesium? Magnesium is found in foods like leafy greens such as spinach, almonds, dark chocolate, yes, some good news there, black beans, and avocados. However, it can be difficult to get the optimal amount through diet alone, especially if your diabetes is actively depleting your stores. That's where supplementation comes in. When choosing a magnesium supplement, opt for magnesium citrate or glycinate. These forms are generally easier for your body to absorb. A typical daily dose ranges from 200 to 400 milligrams, but it's crucial to consult with your doctor before starting any supplementation. Your doctor can help determine the right dosage based on your specific needs and health status. Adding magnesium to your routine isn't just a small tweak, it's a fundamental step in taking control of your health and giving your body the support it deserves. Section 2, the sunshine vitamin, vitamin D. Let's move on to the second must-have nutrient, often called the sunshine vitamin, vitamin D. Don't let that nickname fool you into thinking getting some sun is enough. This vitamin plays a crucial role in diabetes management. Just like with magnesium, there's a significant link between vitamin D deficiency and diabetes, so many people with this condition are low in it. Vitamin D is critical in several ways. Insulin sensitivity. Vitamin D plays a key role in your body's ability to use insulin correctly. Studies have linked low levels of vitamin D with insulin resistance, which means your body struggles to regulate blood sugar, leading to higher levels. Beta cell function. Vitamin D also plays an important role in the function of the beta cells in your pancreas, the cells that produce insulin. Low levels can impair these cells, leading to reduced insulin production. Inflammation, as mentioned previously. Inflammation is a major contributor to the complications of diabetes. Vitamin D is a powerful anti-inflammatory that can help reduce chronic inflammation in the body. Bone health. Diabetics are at increased risk of bone fractures. Vitamin D plays a role in calcium absorption and bone strength. I was speaking at a conference last year and met this amazing person, Michael, who was dealing with poorly managed type 2 diabetes. He was constantly tired and had recently been diagnosed with a bone density issue as well as the early signs of diabetic retinopathy. We talked about all the typical interventions, but he confessed to me that he was almost always indoors. It triggered an important question. I asked about his vitamin D status. It turned out, he was severely deficient. We started him on a high-dose supplement, and within months, not only did his fatigue reduce but he had improved bone density scores and improved diabetic retinopathy results. It was eye-opening to see that a simple vitamin could make such a big impact on someone's overall health. How to get enough vitamin D? While the sun is the best natural source, the reality is most of us don't get enough sun exposure for various reasons. We live in colder climates, spend a lot of time indoors. Or we use sunscreen regularly, which, as an aside, is very important to prevent skin cancer. Therefore, supplementation is often necessary to achieve optimal vitamin D levels. Experts typically recommend daily supplementation of 1,000 to 4,000 international units, IU, of vitamin D3. This is the most effective form. You'll want to check your blood levels regularly with your doctor, because the ideal range is 30 to 50 nanograms per milliliter. Section 3, the insulin booster, Chromium. Next up is an unsung hero that often flies under the radar, Chromium. This trace mineral is deeply involved in how your body uses insulin. Think of it as the insulin booster. Here's how it works: enhances insulin action. Chromium assists insulin in transporting glucose from the bloodstream into your cells. It makes insulin's job more efficient, preventing glucose from lingering in the blood. Improved blood sugar control. By helping insulin work better, Chromium can help improve overall blood sugar control, reduce fasting blood sugar levels, and lower hemoglobin A1C levels. Cholesterol management. Research also indicates that chromium is linked to reduced cholesterol levels, which is an additional risk for diabetics. I had a patient come in complaining of extreme fatigue and blood sugar numbers that just wouldn't go down. She was doing everything else right with her diet, exercise, and medication. I asked her about the supplements she was taking, and when I mentioned the term chromium, she looked puzzled because she had never even heard of it. After doing some research, she decided to add chromium picolinate into her regime, and within a couple of weeks, she had more energy and her blood sugars started to stabilize. It reminded me that sometimes the smallest things can make a big difference. How to get enough chromium. While chromium can be found in foods like broccoli, whole grains, and lean meats, it can be hard to get the amount you need, especially if your diabetes is contributing to deficiency. Supplementation with 200 to 1000 micrograms of chromium picolinate is generally recommended, as this is easily absorbed by the body. Always consult with your healthcare provider before starting any new supplement, especially if you are on other medications. Section 4, the heart-healthy fats, omega-3s. Let's talk about heart health and a set of nutrients that are vital for diabetics, omega-3 fatty acids. These healthy fats do so much more than protect your heart, they are essential for managing diabetes and improving overall health. Why are omega-3s so vital? Reduce inflammation. Omega-3s, especially EPA and DHA, are powerful anti-inflammatories, which help mitigate the chronic inflammation associated with diabetes and its complications. Cardiovascular support. People with diabetes are much more likely to develop heart disease. Omega-3s play an important role in reducing triglyceride levels, improving your cholesterol profile, preventing blood clots and stabilizing heart rhythms. Improved insulin sensitivity. Some studies suggest omega-3s may improve insulin sensitivity, although this effect can vary. I had a client named George, a retired gentleman who loved to cook and enjoy good food with friends, but had been diagnosed with diabetes and suffered a heart attack as well. He was frustrated and scared about his diagnosis and didn't know how to improve things. He was reluctant to introduce many more changes in his life but agreed to include omega-3 supplements. With this addition, and with some other very small dietary tweaks, his blood lipid panel showed improvements, his inflammation markers decreased, and he was finally starting to feel better. He was so grateful that one simple change could make such a big difference in his cardiovascular health. How to get enough omega-3s. The most direct way to get enough omega-3s is through supplementation with high-quality fish oil or algae oil. If you prefer a plant-based option, aim for a combined daily dose of 1000 to 3000 milligrams of EPA and DHA. You can also include fatty fish like salmon, mackerel, and sardines in your diet twice per week. Plant-based alternatives include flax seeds, chia seeds, and walnuts, but understand that your body needs to convert these into EPA and DHA, which is not a very efficient process. Section 5, the cellular defender, vitamin E. Finally, we come to vitamin E, a powerful antioxidant that helps protect your cells from damage. For diabetics, this is crucial. Here's why vitamin E is so important. Fights oxidative stress. Oxidative stress is a significant problem in diabetes. High blood sugar levels lead to the production of harmful free radicals that damage your cells, contributing to complications like heart disease, nerve damage, and kidney problems. Vitamin E neutralizes these free radicals, improves blood vessel function. Research shows that vitamin E is involved in maintaining the health of your blood vessels. This is essential for reducing the risk of cardiovascular issues. Reduces inflammation. Vitamin E works to mitigate inflammation in the body, which is vital in the management of diabetes. I had a patient who was facing the devastating news of an impending amputation due to severe diabetic neuropathy in her feet. We made sure we addressed all the necessary changes in her diet and medication, but also added a vitamin E supplement. She had shown high markers of oxidative stress. Within 3 months, she returned and showed dramatic improvements in the health of her feet. While she still needed ongoing care, the need for amputation was eliminated. It showed me how vital vitamin E can be in helping to reduce oxidative stress. How to get enough vitamin E? While you can get vitamin E from foods like almonds, sunflower seeds, spinach, and avocados, many people natural vitamin E, D-alpha-tocopherol, is recommended. The key here is natural because your body can absorb and use it much more effectively compared to synthetic options. But remember, too much vitamin E can increase the risk of bleeding, especially if you are on blood thinners. Consult with your doctor before starting any new supplement. So there you have it. The top 5 essential nutrients that every diabetic should consider: magnesium, vitamin D, chromium, omega-3 fatty acids, and vitamin E. Each of these plays a vital and unique role in helping to improve insulin sensitivity, combat inflammation, protect your heart, and reduce the risks of complications. They are not a substitute for medication or dietary and exercise changes, but they are powerful partners on your journey to reclaiming your health. Remember, you have the power to take control of your health. It's not about just managing diabetes, it's about thriving despite it. These are practical steps that you can implement today to start living a healthier, happier life. Don't just take my word for it, do your own research, and consult with your doctor to find what's right for you. If you found this video helpful, please like and subscribe to our channel Healthy Inside, so that you don't miss out on the next health tips we have for you. I'm on a mission to help people live their healthiest lives, and your support means the world. What other health topics would you like to hear about? Let me know in the comments below. Until next time, stay healthy and take good care.